of my favourite parts about my job is the kindergarten visits. We put together a project where we would go and perform some visits to kindergartens within the city of Whittlesea. It began in 2014 and we have in this time seen over 2,000 children. Since the beginning last year alone, I think we saw somewhere between 600 and 700 children. About 25% of those were in need of further referral or assessment, whether or not it was with podiatry, physio, speech or OT.
But each year more kinders are coming on board and getting into contact with us to join the program.
What we're providing is not only direct participation with our children, but also too there's indirect and further involvement in health promotion and understanding good footwear and foot health.
We undertook accreditation in December, which was a great opportunity to stop and look at what we'd achieved since we had merged, and we had a list of key achievements that we'd done in that time, including a new org structure, having a new board, having lots of integration work that happened with some teams, and it's obviously still ongoing, ICT integration, and one of the bigger things which was signage across all the sites as well. One of the bigger things from a quality perspective, given my role, was that the 4 accreditations that we had, we actually met all of the required standards, which was an amazing achievement for an organisation that had only been merged for 9 to 10 months at that particular stage.
I'm an adult speech pathologist, and essentially what that means is I see anyone with communication or swallowing difficulties. So we've excitingly just started the adult speech pathology service here at Hume. Historically, Hume hasn't had adult speech, and just before the merge, Whittlesea got some more funding, which has actually meant that we can set up a service in Hume for the very first time. It's been really fantastic for me starting to set this service up to have Bethany, the adult speech pathologist from Whittlesea, able to really show me her processes and take me through what's worked over there. And it's really fantastic that we now have adult services across both Hume and Whittlesea, and that we can work together as a united team to make that all happen.
So Boyd was diagnosed with autism, and we started using DPV Health, which was then Dianella, about 12 months ago. We started out getting a diagnosis that was, I suppose, pretty devastating and overwhelming, and we really didn't know where to begin. Here we are 12 months later, having accessed, I suppose, a huge range of services that I would not have even thought Boyd would need to access. So before, I would often feel really overwhelmed. I didn't understand why he was doing what he was doing. So you'd often feel a bit lost. And to have someone to say, well, this week this is going on, and they can tell you, well, that's probably due to X, Y, and Z. So you might want to try maybe doing this. Your whole parenting style is able to change. So to see an improvement in things that we've, like, I don't know, I never thought I would see an improvement in, like just general behaviour, like being calmer. And so he's able to communicate with me a lot better about his needs as well. So I think it's been, pretty phenomenal, really. It's just, you sometimes think you're a bit of a number, because you just, it feels like that sometimes. And but you guys haven't made us feel like that at all.